Welcome back to East Texas Live. The Trinity Mother Frances Lewis and Peaches Owen Heart Hospital opened its third and final phase last month, and the hospital is continuing to grow with a new heart valve clinic.
Dr. Neelan Doolabh is here, a cardiothoracic surgeon at the hospital, joins us now with more on the state-of-the-art clinic and the procedures. Nice to have you here.
Thank you for having me.
You and I were speaking earlier. I mean, when you say minimally invasive, there's a picture of this in the dictionary. It's amazing how small an incision you have to make to do this.
Sure. You know, it's actually ridiculous. Instead of dividing the breastbone,
cracking the chest, the whole thing. Yeah.
Right, which is the biggest limitation of heart surgery because the bone has to heal and it takes 2 months to heal. Now we just sneak in between the ribs, make a small little incision, and let my patient start driving after 2 weeks.
That is incredible. Right. Well, tell us a little bit about the clinic that just opened at the hospital.
The heart valve clinic is basically an efficient way of treating patients with heart valve disease. You know, some of these diseases, particularly aortic stenosis, if not treated, recognized, most of these patients don't live beyond 2 years. So the heart valve clinic is a way for us to identify these patients, have them come into one doctor's appointment where they see a heart surgeon, a cardiologist, as well as an echo tech. And right there on the spot, we determine a treatment plan for these people and get them taken care of.
Wow.
You mentioned how I ask also, you've been doing this quite a while, but I mean, these procedures are just, you stand back occasionally and just go, you're amazed at how far technology has come. You're teaching people who taught you this procedure.
Right, yeah, I go back to Southwestern, the big medical centers in Dallas, and teach them how to do this operation. And you know, the true reward is seeing our patients, particularly when they visit us in the post-operative setting. They just do so well. You know, there's 1,014 programs in the country that do heart valve surgery, and we're ranked in the top 30, the top 3%, last 3 times in a row.
Oh, fantastic.
Not the Mayo Clinic, not New York, not Chicago, right
Tyler,
here
Texas.
Tyler, Texas.
Yeah, and that's what makes it so unique. Now, why is there a need for this heart valve clinic here in East Texas?
Again, we're just missing these patients, and you know, oftentimes they're hidden in their family care doctor's office with the assumption that heart surgery is a big deal. My patient's, you know, 80 years old, and it's going to be a big deal to put her through heart surgery. And what we do now is we have a system in place in which any patient that gets an echocardiogram in the hospital that is remotely abnormal, we're notified. Once we're notified, we contact the family doctor and say, would you like us to be involved in the care of this patient? You know, typically, again, the assumption is that they're too sick to have heart surgery. When we look back at these patients, their overall operative risk is less than 4%. So, you know, we can see these people, get them taken care of, and once they have heart valve surgery, their life expectancy goes to normal, to that of a person with no heart valve disease, as opposed to less than 2 years.
And you see people of all ages with this, right? This is not something you think, well, this is someone who's 70 or 80 years old. There's people of all ages here.
You know, if you have a heart murmur, and a lot of us have been told that, you should be seen by a doctor and at least have this followed. It's 5 million Americans every year are diagnosed with this problem, so it's not a small amount.
No, not at all. Well, how can our viewers get more information about the new heart valve clinic?
Sure, we have a phone number, 606-7310, and you know, basically contact your family care doctor or just contact us directly. If you have a murmur, it's easy to come see us. We do your echo on the spot, have you seen by a cardiologist. You may not need an operation, which is fine, but at least you need to be followed, and that's what we're about.
If nothing, ease of mind for that as well.
Exactly right.
Dr. Neelan Doolabh, thanks for coming in. Nice to see you.
Thanks for having me.
Thank you.
Come back, please.
Yes, sir.